Welcome, Mayor Renner. Thanks for joining us.
Thank you very much.
You'll be starting soon.
Mayor Ricca, thanks for joining us. We're going to be starting in about a minute here. We just make sure you're on mute until we go to the comment section. Thank you. Good morning, everyone. We'd like to thank all of our media partners who are watching on one platform or another for joining us today for the information on our Heart of Illinois sub-regional reopening plan. We have a number of mayors and board presidents from around Central Illinois that are also joining us today. We have Mayor Dillon of West Peoria, Mayor Harrell of Peru, Village President Mike Hendrickson from Germantown Hills. We have Mayor Call from East Peoria, Mayor Manier from Washington, Mayor McDowell from Canton, Mayor Luft from Pekin, Mayor Mike Phelan from Peoria Heights, Mayor Terry Renner from Bloomington, and Mayor Ricca from the village of Bartonville. So we have a good group of local leaders who are joining us today to present the plan that was presented to the governor's office and IDPH last week. It's my honor to represent this distinguished group of elected officials who have had an opportunity to digest this. All of us, I think, as everyone will probably mention, our number one concern is to get our local economies started again and do it very safely. As will be presented by Monica, this plan was driven by the health department and the metrics that you will see and that Monica will explain meet or exceed what the governor has established in his Restore Illinois plan. So that information will follow. We're trying to be brief today, so we stay focused on the main parts of this plan. And now I'd like to turn it over to my good friend from the Peoria County Board, Chairman Andrew Rand.
Thank you, Mayor Ardis. Welcome, everyone, this morning to the Central Illinois conversation about our plan to proceed with restoring the hardest Illinois to some sense of normalcy. We're joined together on this today's call because we have the common interests in the health and welfare of the entire region, as well as common interests in its economic prosperity. More than 70 days ago, the county of Peoria at the City County Health Department on Sheridan opened the Emergency Operations Center under the direction of Monica Hendrickson, the director of the City County Health Department here. And over 25 disciplines have been represented in the Emergency Operations Center as it has grown and grown and grown in its scope of responsibility and complexity. And as Director Hendrickson is fond of saying, it's one giant trust exercise, given the amount of delegation of responsibility that's been going on. And I'm sure if you take a look at your EOC charts and your emergency management planning, all the elected officials know what I mean. At the center of this county's health department responsibility in our EOC has been Monica Hendrickson. And she has worked in tandem with her health department professionals in Tazewell, in Woodford, and each day as we have our info briefing in the afternoons here in Peoria, we always comment on representations made for Tazewell and Woodford counties as well. I'd like to tell you that Monica is special, and that would be an understatement. She landed in Central Illinois some time ago and went to work for the previous department head, Greg Chance, who was fortunate enough to hire an epidemiologist. And we'd never had an epidemiologist in our public health function. I'm thinking in the future, most health departments will have to have them. Monica is a graduate of the University of Illinois and received her master's degree in epidemiology from the University of Michigan. MGO Blue, she tells me. The science first mantra has been our playbook here. Part of why we have asked the governor's office to accept the plan for a region smaller than the region perhaps that was described in his plan release is something Monica will have a chance to explain today. But on behalf of all of the people in our Emergency Operations Center, all the planners, scientists, contact tracers, hospital workers, Monica Hendrickson has created for the region, I think, a very easy to adapt model of compliance so that we could move towards the phase that we're in and back towards economic prosperity. Thank you, Monica. We look forward to your presentation.
Thank you, Chairman Rand and Mayor Ardis, for that introduction. So I think we'll just kind of segue right into what the Restore Heart of Illinois plan looks like. And to kind of give a little bit of some, I think, grounding of this plan, it was submitted to the Illinois Department of Public Health as well as the governor's office, really to provide feedback and an understanding about how to take the Restore Illinois plan, which is a public health approach, and implement it at a local level. So the Restore Heart of Illinois plan is a sub-regional reopening implementation plan. And it really focuses on an 11 county region. The north central region that the Restore Illinois plan covers is 27 counties. And what we are focusing on are 11 counties: Bureau, Fulton, LaSalle, Livingston, Marshall, McLean, Peoria, Putnam, Stark, Tazewell, and Woodford. Our focus for these 11 counties is really to understand that how the virus would transmit is how people move around a community. And so with that, this Loving County region, from just commuter data, is really a strong indication of how we would see people and thus the virus actually move about. So when we looked at the considerations for our plan, we really focused on three parts. The first part is a gradient approach. And the idea behind this gradient approach is to minimize surge. The next one is to use local data interpretation and response activity to drive how we move forward within planning and implementation. And then the last one is to really allow variance, and it supports voluntary compliance. The more individuals that we are able to embrace in using public health principles in terms of implementation, that assists the public health and healthcare capacities in terms of controlling and being ahead of this virus. So when we talk about our Restore Illinois plan and the Restore Heart of Illinois plan, they're not really that different. So as you can see from this graphic, there are 5 phases of the state plan, rapid response all the way to Illinois Restored. What the Heart of Illinois plan includes are 3 stages that encompass the 3 phases of flattening, recovery, and revitalization of the governor's plan. The difference is really in the details where, depending on the entity, we are asking for variations to maybe bring forward something that might not be seen until phase 3 of recovery earlier in a stage. Likewise, we might also have things within a stage that line exactly with what the governor's public health approach is as well. So again, looking at it as really much within the scope of the framework set out by Restore Illinois. So when we speak of the gradient approach, it really thinks of it in terms of having smaller increments of change to allow less variation in capacity. As Chairman Rand mentioned, I am an epidemiologist by training and not a graphic artist. So this is my best attempt at this, which is the idea that if you throw a ball down steps, the ball bounces back up. And that's surges that we would see in terms of our healthcare and public health capacity. However, if we do smaller increments and more gradual approach, we hope to minimize or decrease these surges. Again, recognizing that it's the capacity that's always been really at the heart of our response within this pandemic. So where do we sit right now? This is a current status as of yesterday for the North Central region. Again, that 27 county region. And you'll see across the board, even with 27 counties, we sit strongly within phase 3, whether it's positivity values, the change in positivity over time, hospital admissions, even the capacities of our ICUs and ventilation. So really, we've been, for the past 11 days, since they've been reporting this data this way for the North Central, we've been strongly within phase, within this phase. And I think that's really important to recognize in terms of how we are responding, as well as the fact that data is always going to be our primary driver of moving this forward. So I kind of will pause here so you can see a little bit of this data and recognize that we really are sitting in a place that allows us to be comfortable about what we're proposing in this implementation plan, that it is data driven. The other data point that the Restore Illinois provides is looks at positivity over time as well as our surge capacity. And you can see with the dates reporting below that overall, in terms of our ICU reporting, our 7-day rolling averages, we're slightly on a decline in our large region. And again, really within that approach to be strongly positioned for phase 3 of the governor's plan. I think there's a lot of dialogue that needs to be understood about where we have been in the past. So this is actually for Peoria region, which I think when we talked about sub-regions, and the governor spoke of it, I think really well, which is there are a lot of variations of how the state's divided depending on authorities and jurisdictions. from the state level, whether it's EMS regions, IDPH regions, healthcare regions, it can go on. But for our Peoria Public Health region, what you see here is that, 314 is really when we started seeing cases here and testing capacity. But moving along the line, our testing numbers have increased and our percent positivity continues to stay below that 20%. Right now, that last week of 5.2, we're sitting just under 10%. I think we're at 7% right now for percent positivity for that region. So again, even looking a little bit historically, our region has been really within that phase of what the governor proposed as a criteria to move into the next phase, from phase 2 to phase 3. But data is really important, and we've always wanted it to be a central piece of this conversation. And so when we're talking about how to make the determination of moving between stages, we're really assessing our readiness on 4 capabilities: the healthcare system, public health, mitigation or PPE, personal protective equipment, and then community engagement. The first 2 numbers, healthcare system and public health, that really corresponds a lot with what the state's plan also has in terms of capacity of our hospital systems, capacities of your local health departments to do contact tracing and investigations in a timely manner. You'll see that there is scores associated with this. In the larger plan, for example, the healthcare system is scored out of 12, in which they are assessed on everything from overall bed capacity to in the ICU to ICU specific for COVID, as well as, again, ventilation utilization, and then specifically COVID-related ventilation, and then COVID-like illness hospitalizations. The reason why we went further in specifics for the healthcare capacity is because we actually communicated with OSF St. Francis Medical Center and Unity Point Health Peoria, which covers the Methodist, Pekin, and Proctor areas, because the capacity issue's always been on their shoulders. And so with that, and the endorsement of both healthcare hospitals who've endorsed this plan and reviewed it, along with our federally qualified health center, Heartland Health Services, we wanted to make sure that they were very comfortable with how they're being assessed in this plan, and recognizing that they're going to have the highest weighted score in terms of the community response. Likewise, public health follows the same track as well. And then we added 2 more capabilities that we wanted to measure, which was PPE, so the level of protective personal equipment, not only for our hospital systems, but for our first responders and some of those vulnerable population settings, such as our congregate and long-term living settings. And the last one, which I think makes our plan really robust, is that community engagement. It looks at our capacity for, as Chairman Rand mentioned in our EOC, all the supporting entities. What is the capacity on our alternate housing system? What is the capacity of our first responders? If they are at a high absenteeism rate, is that something that needs to be considered and something that would pause us from moving forward in a response? Likewise, we also really wanted to address that compliance and best practices. And so there is an assessment portion to the community engagement from various disciplines and protocols to assess their capacity to move forward. So this is a kind of a quick guide. And again, I wanted to also preface, Mayor Ardis spoke to this, and so did Chairman Rand, that this has been provided and we're requesting feedback because we know that this document's a living document. The state comes back and provides us with changes or requests additional support. We recognize that our plan can be adapted, but this is just a quick implementation plan. And so you'll see that overall face coverings and 6-foot separation are going to be required throughout the Heart of Illinois stages. But then we also give variations to things such as playgrounds, which, in stage 1 might be closed, but recognizing that they need to open within stage 2 and stage 3. Likewise, we ask for plan reviews. So outdoor smaller events might get to open at an earlier time frame, but we would be asking for plan reviews to understand what they're doing for controlling and putting in public health and other safety measures. And so this is just a few of them. The list is very, very expansive, and I'd like to really say that the team that worked on it, especially the City of Peoria's community development, did a fantastic job researching and getting best practices. And I think that kind of leads to the last part, which is this compliance aspect that we want to really focus on. So this is really coming soon. It's a work in progress, but it's the idea that we'd ask businesses to register, provide their plans and support, so that individuals in the public can actually review it and understand what this establishment is doing. I think a lot of our agencies want to do the best. They need guidance. And in the absence of guidance, they're going to create things that maybe don't adhere to public health and healthcare principles. And so by working in coordination with them and having them be able to submit that information and letting the public actually view it, understand it, it helps support and drive a lot of this implementation. And so that's really a brief summary of what this plan really includes. And where we'd like to see our region kind of move forward as we, again, try to balance the fact that we want to make sure that we're able to properly relax policies and restrictions, but at the same time adhering to the public health and healthcare safety measures.
Thank you, Monica. We'd also like to acknowledge that the Heart of Illinois plan has been endorsed and letters of support have been sent to the governor and IDPH by OSF, as well as Unity Point and Heartland Clinic, which is our federally qualified health clinic here. So again, a broad range of support, and we're also comfortable with the connectivity of our health departments within this area. At this time, we'd like to recognize, we'll just do it alphabetically, the other mayors that are in attendance today and welcome their comments. So we'll start first with Mayor Dillon from West Peoria. Mayor Dillon?
Yeah, just I think I turned you off, Jim.
We can hear you.
Can you hear me?
Yes.
Okay. First of all, I'd just like to thank Mayor Ardis, Chairman Rand, and Monica for their great work in this effort, and I fully support what you guys are trying to get done for our region.
Thanks, Mayor.
Thank you.
We have Mayor Scott Harrell from Peru next.
Hello, everybody. I would also like to thank Mayor Ardis for what you're doing here, and Chairman Rand, and I'm very impressed with everything that Monica's doing, and I think it's a very good guideline, and we'll see where it goes from here. Just a quick question: is anybody receiving anything from their food, from restaurants that they're asking to do outside dining? I know the ILCC just came through and said that they can't do any outside dining. If you go pick up a carryout order, you can't stay on their property. But I know there's some towns, it was a town up in one of the suburbs that was going to close down some streets to allow that. Has anybody heard anything about that? And I don't want to spend much time on it. I just wanted to throw it out there while we were talking. But the program is great. I hope it attracts their attention, because with our positivity rate of 9.1, and it's gone down 0.06, in the last 14 days in the hospital admission, that's a key, down 35%. So thank you for all the work you're doing.
We have Mayor, Village President Mike Hendrickson from Germantown Hills.
Thank you. Some very good work. As a small village like we are, while we're located in Woodford County, we are very closely aligned with Peoria and Tazewell County. Our residents, I think it is over 85% of the people that work have a job in Germantown Hills, travel to Peoria or Tazewell every day to do their job. So we recognize that we're a small piece of it, but even a smaller piece of the Heart of Illinois region. The plan's well thought out. It's great that it's endorsed by our hospital and leadership. It's got medical metrics. And I think probably most importantly, it's important that our region's people recognize this is local people with local knowledge, credible elected officials that can commit to this, knowing that we can make a difference in a very localized area. So thank you very much and appreciate it.
Thanks, President Hendrickson. Next, Mayor John Call from East Peoria, who has been and shown a lot of initiative and local leadership on this in this area, and has really been a loud voice for the community to help us get our businesses back on track. Mayor Call. In just a minute, he may have gotten called away. Next, we have from Washington, Mayor Gary Manier.
Yes, thank you for all the work that everyone has done, and what a great plan. I feel it's truly the time that we have to do something for these small businesses that are truly on their knees at this point. Again, we have to do it safely, and I think the data shows that we've done a great job to this point to protect our residents and our citizens. So I think it's time to give our businesses a chance to regroup and try to make some money again. So again, thank Monica for all that great work, and Chairman Rand and Mayor Ardis, thank you so much. And we're going to continue we just have to do this together. I think once we all are on the same page now, and hopefully the governor will listen to us. Thanks a lot.
Thank you, Mayor. As I mentioned, one of our local mayors who has shown a lot of leadership and been in front of this issue to help support and hopefully get our local businesses started back up again. That's Mayor John Call from East Peoria. Mayor. Mayor Call, can you hear us? Can the other mayors hear me right now? We're having a little bit of technical. Okay, we're getting a thumbs up there. Mayor Call, we're having some audio issues. We can see you, but we're not picking up your audio. Okay, we're going to try to get that figured out. We'll go to Mayor McDowell from Canton. The advice from the technical folks is if you're having a hard time, maybe you want to log off and log back on real quick. For anybody that's having a problem hearing us. Is Mayor McDowell from Canton out there? Mayor Luft from Pekin.
Can you hear me?
Yeah.
Jim, can you hear me?
Okay. Who's that?
Can you hear me?
Yes, we can.
This is Mayor Love from Pekin.
Hi, Mayor. Go ahead.
First, I want to say, Jim, Andrew, and Monica, much appreciated. Outstanding job. And I appreciate the fact that everybody else on here is pulling together. We stand stronger in numbers. So this is a very good thing, very responsible, very safe. It is time to move this forward. I don't think up north there's a realization of, in our positions, how tangible we are and living next door to people who are closing businesses and losing their life savings and struggling to put food on the table. The data speaks for itself. There's absolutely no reason that this plan cannot move forward. As you stated, Jim, and others have, this is a good group of elected officials. It's a good group of public officials. We know what we're doing.
Yeah.
So I would hope that we would continue to grow and support with this. And in my opinion, this plan is not something that anybody could justify saying no to. So I'm willing to continue to move forward with this and hope that we're all on the same page.
Thank you, Mayor. We're going to go back again and try, and I've said it once or twice here, but I want to reinforce that Mayor Collin East Peoria has been a leader on this issue in the area. He's working really hard to help us get local businesses back open, and we're very proud to have him here with us today. Mayor Call.
Can you guys hear me now?
Yes, we can. Thank you.
Yeah, I apologize. I don't know what happened there. I think when she unmuted me, I had myself on mute maybe. First of all, thank you guys for allowing me to join you today. I appreciate all the efforts here. I have been very vocal the last 3 weeks, and man, it's just, it's great to see so many people from the sub-region, if you will, rallying behind a plan. I appreciate all your efforts here, and I hope it goes somewhere. Thank you.
Mayor. We'll try Mayor McDowell again. Mayor McDowell in Canton, are you with us? Okay, then we'll go to Mayor Mike Phelan, the Village of Peoria Heights.
Thank you, Mayor Ardis, and thank you, Chairman Rand and Monica, for all your work on this. As a former Peoria County Board member, I'm very proud of the leadership shown by Peoria County during this crisis, and I've said all along that any plan had to include support from public health. So I think you've achieved that. It's a good plan, and I support it. So thanks again.
Thanks, Mayor. We had Mayor Terry Renner from Bloomington.
Can you hear me?
Yes, we can.
Okay, thank you. I hate to be sound like a broken record, but Jim, I just want to thank you so much for your leadership on this, as well as the chairman and Monica. I do have a question, and this is probably more for Monica, and this is the kind of thing that I'm liable to encounter. And by the way, I just wanted to say I'm very glad that you're an epidemiologist, because I got all kinds of crap yesterday from people saying, we need an epidemiologist, or this is just a health department official saying this. So I'm so glad that you are. This will give me extra oomph as I'm responding to people as to why we're pursuing this, and that we obviously have public safety as our main, public health as our main goal. And we do have an epidemiologist as an expert who's leading this charge. But how will we monitor the, or how will we assess the monitoring of and spread of the positive tests in this region now that we've got some reduced capacity? Is there something that you can clarify that I can bring to my constituents and that I could understand?
Of course, and maybe I should have clarified that a little bit when I was speaking to the different capacities. All those capabilities are data points that we actually already measure. And so I I think that's a really important part about increased testing in general. So the public health capabilities that we looked at also included positivity rates, recognizing the fact that your number of cases needs to also account for the number of tests you have to do in that region. This data point is actually collected by the state, and local health departments have the ability to access it. So a lot of the data that you're going to see that we are requiring to monitor are ones that the hospitals utilize through their reporting to the state, as well as what local health departments are also monitoring as well. And so that's a great question. So we're using the same scorecard and the same data source as the state is for those two capabilities. But then again, we're adding some as well, recognizing the fact that we want to be able to monitor a little bit more closely locally.
Great. Thank you so much. And again, I appreciate so much. I can't tell you all of your work and all of your leadership. And other than thank you, that's all I have.
Thank you, Mayor. We have Mayor Ricca from the Village of Bartonville next.
Can you hear me, Jim?
Yes, we can.
From the larger cities and the large county. It's just been outstanding from Chairman Rand and Mayor Ardis. And Monica, I think Mayor Ardis said it best last night at his council meeting, that in Monica Hendrickson, we have a rock star. It was a pretty good quote, I thought. Thanks, Jim. Bartonville's on board with this. We're really looking forward to getting some of our businesses open back up. And I don't want to cite, I know that Chris Setti has been a huge help to a lot of the smaller cities during this whole COVID-19 pandemic. So I just appreciate everything the county and the city and the health department's done. Thank you.
Thank you, Mayor. I'm going to try Mayor McDowell in Canton one more time. Just, I don't know if we're having technical difficulties. Mayor McDowell, would you like to make a comment? Okay. Looks like we're having technical difficulties, but Kent McDowell is the mayor of Canton, and he's on the call, and he's been very supportive of the effort so far. So are we ready? Are we ready for comment or for questions? I think the public information folks have a couple questions submitted by the media, which we'll try to get answered before we break today. I think, probably one of the things that we know, because all of the mayors have also asked the question of, well, what if the governor says no? What are you going to do? Well, the plan is to continue to move forward. I mean, Monica thinks that it would probably take us a week to 10 days to ramp up to implement our plan, which we're going to be doing. And if the governor comes out and says no, our plan is going to continue to move forward. And I think the clarification has to be and will be made that we acknowledge that there are particular businesses, bars, restaurants, the hair folks and others who are licensed by the state who have to take their state licensing into consideration. And again, we're not in a position to overrule the governor's executive order. And so, with that said, those businesses, as Mayor Call has said over in East Peoria, those businesses have to take that into consideration, and they will. And we can't tell them to disobey the order. So that's really where we're going with this. Is we're planning on moving it forward. We're going to continue in that vein, and if the governor says no, then we'll continue the implementation because we're ahead of his plan anyway. But those who are licensed by the state are going to have to consider that jurisdictional issue that we can't override. So, Stacy, are you going to present
Yep.
questions? Okay.
Yes,
Stacy.
good morning. Thank you, everybody, for being here. My name is Stacy Peterson. I'm one of the public information officers for the city of Peoria. For our guests, our first question is from Bobby Oler from HOI, and he asks, Governor Pritzker is asked daily about reviewing plans that divide Illinois further than the 4 regions he's already proposed. And he consistently says he's not going to do that because he wants some uniformity statewide while still allowing for flexibility. Are the local governments assembled here today willing to go against his executive orders in the event he rejects your plan? Then there's a follow-up. What will you do for the business owners who would be afraid of losing state licenses if they follow your lead? That's Bobby Oler.
I think we might have answered that question a minute ago. So if they want more clarification from that, they'll let you know.
Thank you, Mayor. I will move on to Tim Shelley from WCBU. His first question is, have you received any feedback from governor's staff or IDPH on this plan yet? And actually, Tim is echoing that question from several journalists today. If so, what was the reception like? The governor has indicated at his press conferences on Monday and Tuesday that he doesn't plan to break down the state, which that second part we've already discussed.
I can speak to the Illinois Department of Public Health that's reviewed the plan. They find it to be a very strong plan. They are very much impressed on the medical and healthcare metrics and public health metrics that were utilized, as well as the additional ones that we put in place. I think likewise, there is a lot of process and further dialogue that's happening between the state entities and local entities about implementation. And so again, I think right now our response from public health has been positive, but we also recognize the fact that we're moving within a variation of the framework that Restore Illinois has set up. And so while it might be positive and they recognize the strengths of our plan and what it is able to do, they also might, understandably be in a different position likewise. And so I think what we've heard so far has been very strong, that it does meet those public health and healthcare metrics is that the Restore Illinois plan was making sure that was in place.
I'd like to take a shot at this question about the size of the region. These regions are too big to be practical, and it makes imminent sense to start a little bit smaller and let them grow. Within each of these regions, we envision what Monica has described as sentinel health departments that have larger responsibilities with respect to the contagion we call coronavirus, and that is with contact tracing and other mitigation efforts where hotspots or outbreaks occur. And I think we have defined the outbreak as 2 or more positive cases. So that's really drilling down to a small level. So fundamentally, the regions are the art of someone else, but the sub-region you're seeing in this presentation is I would just describe as a starter kit. If you understand how the concept of Sentinel Health Department, I'll ask Monica to explain that some more, would work, you could see how you could bolt onto this. This notion about have we received any feedback, I want to kind of answer that from the County of Peoria's perspective. No, and we don't interpret that as negative either, but we're not arrogant enough to think no news is good news either. There is a set of restrictions in Illinois related to businesses that earn their livelihoods through state-issued licenses, and we want to be respectful of how that comes to pass and not offer any advice to the contrary. But because we've received no hard no's, no stops, or no, you don't know what you're doing, we're continuing to move forward. And most importantly, the very metrics of disease or capacity or surge or PPE or positivity rates or how caught up we are on contact tracing. All of the metrics of the governor's outline have either been met or exceeded for several weeks now. And we interpret that as a very good sign here in terms of the health and containment of the COVID crisis in our community.
Do you want to speak to the Sentinel part?
And in regards to the Sentinel, idea of a Sentinel health department, is recognizing that in certain counties and municipalities, there are large healthcare systems, and that partnership with their local health department, not just from a disease investigation, but even resource management, plays a role that those health departments, whether it's McLean County and their relationship with Advocate, or the Peoria area and OSF St. Francis Medical Center and Uni Point Health, there are various health departments that, because of their coexistence within a hospital system, creates a totally different capacity issue on them. And so all health departments have the ability and should maintain the ability to do contact tracing of their residents. That's key. What the idea of the Sentinel is just that ability to get additional data points from your hospital systems and be able to disperse it more readily than necessarily a 27 county region could provide.
Thank you. Thank you for all of those answers. I've got a couple of requests here. One from Sean Newell, who's the news director of WMBD and WYZZ. He'd like you to talk a little bit more about the phase that we're in currently with the Restore Illinois plan, and then what that phase looks like as we transition into the proposed HOI plan.
Sure thing. So currently we are in phase 2 of the Restore Illinois plan, which is the flattening phase. During this phase, I think a lot of people are well aware that there's only essential gatherings, 10 or fewer. We have remote learning. We have limited to no childcare. Outdoor recreation is very limited as well. Even the businesses, it's really focused on, again, maintaining social distancing, open for delivery or curbside pickup. And a lot of things are closed. What moves us to phase 3 of the governor's plan and the Illinois Department of Public Health plan is that we have that positivity rate under 20. And as you can see from the presentation, we actually have sat there for a while as a region even. But additionally, what does that look like in terms of our surge in hospital counts? So I think overall, we do actually have a very strong reasoning to move from stage 2 to stage 3 of the governor's plan. And have been kind of in that seat now for at least 3 weeks, within that 28-day mark, so to speak. Now, how does that mean for us? You saw that stage 1 does overlap slightly with phase 2 and phase 3. One of it would be looking at some of those things that come on board in phase 3 a little bit sooner. But I think overall, it's really looking at 50% capacity. We're looking to kind of open up things at that kind of minimum standard of 50% capacity, assess, monitor those measures before looking at moving on to another stage. So really, the variation is that we're not necessarily picking and choosing specific businesses or types of businesses, but looking at 50% capacity. But that's just one measurement. On top of that, there are protocols, because we recognize that not all 50% capacity of an entity is the same. And I kind of always make the reference to our food program. So the state food code, one, allows for variances within each county, but also recognizes that we assess food establishments based on various risks. Likewise, the Heart of Illinois implementation plan looks at businesses and doesn't just make a uniformic 50% across the board, but looks at what type of risks in terms of contacts, the type of contact and intensity of contacts would be appropriate in that. So utilizing the Johns Hopkins program, where they actually assessed that, we took a risk approach first to understand the different businesses or agencies involved, recognizing the type of contacts that they utilize, the intensity of contacts, and then on top of that, what would be a minimized capacity, and then what other requirements in terms of PPE, engineering controls, and even administrative controls would need to be in place for them to open up fully. This is not everyone let's just open at 50%. There's a lot of steps still involved, and that's why I think the mayor even spoke to it. It's going to take operationally anywhere from 7 to 10 days for communities as well as those agencies to gear up. And so I think what this plan provides is that guidance that we're looking for to assess them in gearing up.
Thank you, Monica. You already touched a little bit on contact tracing, but Tim Shelley from WCBU has a follow-up question. He says, am I reading correctly that PCCHD will be performing contact tracing for the 11 county region under this plan? If that's the case, how will that work?
So not necessarily that we'd be providing contact tracing for the 11 county region, but that we would support IDPH in contact tracing capabilities. I understand that Sentinel sites, it may not just be Peoria City County Health Department. It could be another health department or another one that's attached to a hospital system. Again, we just want to make sure that from data reporting and timeliness that we do know that there are county health departments associated with large healthcare systems that are going to be able to assess data faster because of the fact that the hospital system resides in their county.
Thank you, Administrator Henderson. We've got one more question before we start to close. I'd like to remind our media partners that all of our hosts at the table will be available at our daily press briefings, which resume tomorrow, Thursday at 3:30. You can also email us and we can try to get those questions routed. But for the last question of the press conference from Christina Leahy from 1470 WMBD, she says, masks and social distancing are still in the plan. Are there concerns for enforcing those non-pharmaceutical measures?
So I think there's a key component of the plan is public education, as well as supporting businesses and face coverings and social distancing. That's currently in existence now. But I'd like to speak on this in just generalized term is that it's one of our strongest interventions that we have is face coverings and social distancing. And so with that in consideration, you know, if we see a lot of non-compliance with that, whether it's coming from the community engagement portion, it filters up into the healthcare and public health portions of it. So again, recognizing the fact that if you are not being compliant with these non-pharmaceutical interventions, it's going to go back and really, as a full-on 11 county region, impact us fully. And I think that's really key about this regional approach is the fact that the data being localized helps us respond quicker. We don't have diluted data that is caught up in a 27 county region, but it's much more specific for our region and we can see it quicker and respond faster.
Thanks for those questions, Stacy. Before you go, could you please inform the media partners that are listening in today where they would be able to, if they haven't already accessed a copy of the plan?
Yes, Mayor Ardis, those both Monica Hendrickson's slide deck and the Heart of Illinois Restore Plan can be found on the home pages at www.peoriagov.org and the county's homepage, www.peoriacounty.org. And that video from today will also be housed on that county homepage.
Thank you for that. I'd like to offer an opportunity for any of the mayors that would like to say a word before we close. You don't have to, but if there's any mayor that would like to make a comment before we break, that we'd certainly open the floor for that.
I would like to say something. I did contact our representative over here in Peru, which is Representative Yednock, and we set up an emergency operations center for external surge at the beginning of all of this, and that did not happen, which is a good thing. And we have workstations set up, and I told Representative Yednock that, to offer our building. And if we have to, we'll put people in place to help with that, to be trained and help with the external surge. It's only 4, we're a town of 10,000, but it's help. So if anybody else could do that, it would probably be a good idea to make the offer. Thank you.
Thank you, Mayor. I'm not seeing or hearing any additional comments. So again, to all the mayors, thank you for giving us an hour of your time this morning. We're very confident that we put a very strong plan, respectfully to the governor. We are not looking at, as Chairman Rand said, we're not looking at no comment as bad at this point. Keep in mind that when this whole conversation started in early March, the whole state was being looked at as one unit, and the governor has modified himself to the point where now he's looking at regions, and we really feel strongly that the sub-regions that we've identified don't dilute anything from his plan and actually could make it stronger with the accountability measures that have put in place. So we're very anxious to get a positive response back from the governor. We're going to continue to push forward. We all know how important it is for us to get our business community back up and running, and we all want to do that safely. So on behalf of Monica Hendrickson from the Health Department and Peoria County Board Chairman Andrew Rand, we're gonna close the meeting now. We trust that media will contact any of you locally if they have additional questions. And we're excited to push our Heart of Illinois plan forward. Thanks for joining us.
Thank you.